Hello, welcome to Chatting with Chitness. I'm Dr. Salil Chitness. I'm a pediatric emergency medicine physician, and we're going to be talking about pediatric medical education. We got a very exciting video, so let's get chatting. So today we're going to be talking about appendicitis. So let's first get started with what is your appendix. So your appendix is this little tiny thing that comes out of your colon. I'll have a picture somewhere, either there, somewhere around here. That'll show you how it looks. And we don't really know what the appendix does, which is kind of nice because if you don't have it, nothing really happens. So what is appendicitis? So appendicitis is when that little appendix gets inflamed and it gets sick and it starts hurting and it gets infected. And the crazy thing is we don't really know why it happens, why some people get it and some people don't. It does run in families. All right, so let's go over what you need to be worried about or what you need to look for if you're worried that your kid has appendicitis. So appendicitis classically starts at the belly button and then moves to the right lower side of their belly. Sometimes it can just start at the right lower side. The key with appendicitis is the pain never goes away. It's constant the whole time and it only gets worse. So if your kid's pain comes and goes, it's probably not appendicitis, but if it's constant and they're complaining the whole time, then it could be. Other things is they'll have a fever, they'll have some vomiting, diarrhea, they don't want to eat their favorite foods. You can give them In-N-Out and they'll say no. So if those are happening with your kid and they have right lower quadrant pain, I'd be more concerned about appendicitis. A really quick trick you can do at home is you can have your kid jump. And if they jump and when they land, they have a lot of pain in that right lower side, that's really concerning for appendicitis. Or if you're driving in a car and you hit a bump in the road and they say, my side hurts and they're pointing to the right lower side, that also makes me worried about appendicitis. So if your kid has any of those things, you should probably go to the emergency department to have them evaluated. So let's say you are worried about appendicitis and you take your child to the emergency department. These are kind of the things that you will expect to happen. So first, the doctor is going to examine your child, and if they have a high suspicion for appendicitis, then they're going to get blood work. They'll probably put an IV, give some fluids, give some pain medication because appendicitis is very painful. And then depending on the ER you go to, you might get an ultrasound first that looks for the appendix, or you'll go straight to a CAT scan. The ultrasound is good because there's no radiation, but it's not the best test. It's very hard to find your appendix. Your appendix is very tiny. When it's actually appendicitis, it's the size of your child's pinky. So it's hard to find and it can move around and hide. A CAT scan is for sure the answer. It'll tell you if your kid has appendicitis or not. The only problem with a CAT scan is it does have a lot of radiation. So most children's hospitals and children's ERs will do an ultrasound first and then do the CAT scan last as a last-ditch effort to find the appendix. So if your kid does have appendicitis, there's really only one treatment, and that is to get it surgically removed, so it'll never be a problem again. The issue with appendicitis is if it hasn't perforated, which is popped, then it's pretty easy. They take it out, you get some antibiotics. You usually go home the same day or the next day. But if it has popped, it makes it a little more complicated. It's kind of a longer course. Some surgeons will take it out and do antibiotics for a long time. Some will do antibiotics first and then take it out. So the key is you really want to get to the hospital before it pops. It usually pops around day 3, 4. So if your kid is having this right lower quadrant pain for 1 to 2 days, I would definitely go have them seek advice from your healthcare provider. And that's it for appendicitis. Leave me any comments and let's keep chatting.